trying to decide whether we need to put her on dialysis or not to help get the fluid off.
Kara Burns is a nurse practitioner in the Heart Center at the University of Kansas Health System. For Kara, coming to work here was personal.
I was actually sitting in bed with my husband drinking coffee with my 3-month-old between us, stretching and having an abrupt onset of horrible back pain right between my shoulder blades.
At just 39 years old, Kara was having a heart attack.
A heart attack was the farthest thing from my thoughts. Even being a nurse practitioner, I didn't think it was a heart attack. I had no risk factors, no family history of heart disease.
She had emergency heart surgery and learned her attack was SCAD, a spontaneous coronary artery dissection.
It's the inner lining of the artery tears and then basically just closes the artery down. So it's like a one-way valve, so you just can't get blood through.
The event changed her life, both personally and professionally, for this mother of 4.
In my head and in my heart, I knew I needed something else to see patients that not necessarily have the same condition as me, but ones I can definitely empathize with.
If working in cardiovascular care was the goal, Kara knew there was no better place than the Comprehensive Cardiac Center at the University of Kansas Health System. Not long after changing jobs, Kara changed doctors. She's now a co-worker and a patient of Dr. Paola Roldan.
Which is nice because she's a female, and I think females sometimes just understand females a little bit better than men understanding women. So it's been a good thing.
Kara hopes her story helps others.
I think being the biggest advocate for your own care is the most important thing. Seek out that care you need so that you get the answers that you're looking for.